Hey everyone, I want to chat with you about the quality of healthy relationships and how they seem to impact fertility outcomes. Now, it's something that's well established that having a healthy relationship, an emotional relationship, and emotional intimacy with your partner seems to be a protective buffer against the negative and harmful impacts of stress, anxiety, and all the challenges that are presented when going through fertility treatments. But we had a new research paper published in Rome in 2020, and it looked at a new dynamic, and it really caught my eye because it specifically looked at two relationship dynamics, particularly attachment anxiety and attachment avoidance. And these two spectrums were found to significantly impact the couple's health, the relationship health, and also fertility treatment outcomes. And it's very new because it's adding new information to what we've already known by looking at these two different scales. So the first scale was something called experience in close relationship revised. That's the type of scale that was used, and it's a 36 self-reported questionnaire, and it evaluates for two different types of characteristics. One is attachment anxiety and one is attachment avoidance. And what that translates to is that patients that report higher levels of attachment anxiety, meaning that if the other partner appears to be unavailable emotionally, there is a higher likelihood of the patient feeling or perceiving a feeling of rejection, abandonment. If patients scored high on this emotional construct or emotional scale, what was found was that it correlated to a decrease in the amount of trust they had towards their partner in terms of their loyalty and commitment to the marriage or relationship. It brought the quality of life down during fertility treatments. Obviously, anxiety levels were higher. And interestingly, fertility treatment success rates seem to be lower as well in this study. And the second scale evaluated for attachment avoidance. So what was found was that it basically evaluates for how comfortable a patient is in feeling attachment towards their partner. And if they feel like they have reluctance in self-disclosure, sharing feelings, sharing emotions, sharing what's happening, participating in activities together, or if they have like this extreme need for self-autonomy and have a fear of having to depend on someone else, particularly their partner, there's also an increase in fear for infidelity, fear in having to depend on someone, particularly their partner. And so we see again a decrease in the quality of life. We see a decrease in the emotional health and stress of the couple. And particularly we might see a decrease in fertility treatment success rates as well. So this is a game changing because we're seeing that this is a very strong suggestion that emotional health, relationship health has an impact beyond just emotional well-being and your perception of your mental health and mental well-being. It can translate into actual success rates and your impact on fertility treatment success. Just the quality of intimacy, of romance between a couple. So it's important that when we're preparing for fertility treatments, a journey, a treatment process that usually comes hand in hand with high levels of stress and anxiety, to also seek out counseling if it's required, to have emotional support, to have open conversations with your partner, and to share what you're going through, what you're feeling, how it's impacting you. And if you need help to help communicate that and for your partner to understand that or vice versa, it's worthwhile speaking to a counselor and getting support for these things, because fertility is can be much more easier when you have the support of your partner, if that's a possibility. And we're seeing that it's not only making it easier mentally and emotionally, but it may actually make it easier for you to get pregnant in some of these treatment processes, such as IVF or in vitro fertilization, Now, what's important about this trial is, it's obviously a correlation, it's not causation, because it is an observational study, but it's still, I think, the first of its kind, looking at how a healthy emotional relationship between a couple can actually translate to improved success rates with fertility treatment. So it's exciting to see that, and we'll keep an eye out on what new research comes forth with this type of information and data, and looking further into if these results can be replicated in other study centers and other fertility clinics. But so far we know there's no harm to having a healthier relationship anyways, and potentially more benefits. So if that is an issue, it's something important to discuss with your partner, and also reach out for professional help when it's needed.